Okay, so outside of our patient's room, we'll be in the medication room. We'll be drawing up the medications. I'm going to perform my hand hygiene. I would look up the patient's MAR to obtain the right medication that I'm going to be administering. It'll be the flu shot and their insulin. In the MAR, I would double check the nursing considerations of the medication, the right dosage, the dosage considerations, adverse effects, and my 6 rights, the time, documentation, patient route, dose, and the medication. And I would check the patient's chart to make sure that there's no allergies. And then I would start drawing up. I'm using an alcohol swab after taking off the top of the vial. I would clean. And make sure that it dries. Starting with our flu shot, I would select the appropriate size syringe. I would put on a blunt tip needle to draw up the medication. I would withdraw the appropriate amount of air of the medication that I'm going to be giving. And then I would make sure that this is flat on the table. And I would insert the air above the solution. I would turn it upside down. I would draw back the correct amount and plus a little bit extra just in case there's air in there. Pull it out, put this back on the table, and I would flick to make sure that there's no air bubbles. And then waste according to facility policy till you get to the right amount of medication, and recap using the single hand method. And then I would switch my needles as indicated for administration. And I would label this with the concentration, the patient's initials, my initials, the date, the time, and what the medication is. This is our flu shot. And then moving on to our subcutaneous injection. It's already been cleaned. I would take our insulin syringe. The dose is 10 units from the medication record. We would draw back the air, hold it down, and insert above the solution. And then withdraw the appropriate amount, plus a little bit extra for air. And then we would recap using the single hand method. And then make sure to label this one with our concentration, the medication, patient's initials, my initials, the date and the time. Moving into the patient's room. Knock, knock. Hi, my name is Julia. I'm going to be your nurse today. I'm going to be giving you a couple of injections. We'd provide privacy for our patients. Can I have you state your name and date of birth? And I'd verify on the wristband. And can I ask you if you have any allergies? Make sure the patient's not allergic to any of the medications that we're going to be giving. Okay, I'd educate the patient at this point. So we'll be giving you your flu shot today and your insulin injection that you usually get. Make sure that they don't have any concerns. Starting with the flu shot, we perform our hand hygiene. Put on some gloves. For the IM injections, you would consider all 3 sites your vastus lateralis using a hand breadth from the hip and the knee. your ventrogluteal, using the greater trochanter as your site to identify, and then the deltoid, which is what we'll be doing today because there's only a 0.5 ml of the medication. So I'm just going to expose you a little bit so I can get to your arm. To locate the deltoid, you would go 2 finger breadths below the acromion process and use the axillary crease to form a triangle, and you would go right in the middle of that. We would cleanse the site using an antimicrobial agent. Uncap the needle. You'd want to pull the skin tight here if you're not using the Z-Track method, and insert using a dart-like motion. You'd want to stabilize the syringe using your non-dominant hand and administer the medication. You'd withdraw, activate the safety device, and then put it into your sharps container. Hold pressure on the site to make sure it doesn't bleed, and put on a band-aid. Before administering, you would check the area for any tenderness or irritation so that you're not further irritating the area. And then moving on to the subcutaneous insulin, we're going to expose your tummy. You'd again cleanse the area. Uncap your needle. You'd pinch the skin here and then administer dart-like straight into the middle at a 45-degree angle. Administer. You could stabilize with your non-dominant hand if that was a preference. You'd withdraw at the exact same angle, put your safety device on, and put that into the sharps container, and make sure that there's no bleeding. Make sure that your patient's comfortable and put them in low and locked position. Take off gloves and perform hand hygiene.